So this report showed that the Mayo Clinic is number one out of all the hospitals. That's fantastic. I'm really pleased. How did you feel about it?
Well, thanks. We thought it was great recognition, a nice recognition of the commitment that Mayo Clinics had to using the web, first in the traditional uses of the web, but then socially for a long time. And it's nice to see that recognized. I think first of all, being patient-centric means having relevant content and trustworthy content that patients can rely on. And so we started our Mayo Clinic Health Oasis website back in 1994. So we've been at this a long time, launched mayoclinic.com sort of officially in 2001, I believe. And then, having a huge number of YouTube videos, for instance, that are dealing in depth with patient concerns, sharing the expertise that our physicians have with the broader world. And so I think it's a commitment to having good, reliable content available to patients. And sort of specialty by specialty, project by project, we see a significant impact from having made that content available. One example that I've used is Dr. Ruben Mesa, who did a series of videos on myelofibrosis, which is a relatively unusual blood cancer. And he did those when he was here in Rochester, Minnesota. He went down to head up our practice in Arizona. And we saw over the next 5 years, the practice grew by something like 130%. And he attributes this, he says this isn't the only factor, but certainly it's one of the factors that has played a role by making this content available, particularly through video. People generally aren't concerned about their health until they're concerned about their health, which is, until they actually get sick, then it isn't top of mind with them. But once it is top of mind, then they're looking for as much content as they can get. And so that's where the typical rules of a 30-second video or a 60-second video being what's optimal don't necessarily apply, particularly with rare diseases and conditions where people are thirsty for the knowledge. Sure. We definitely see in the physicians for whom we have an introductory video or a video in which they're sharing some deep expertise about a particular topic, we definitely see them reporting to us that they're getting more requests for patients to see them because building a rapport. They're first of all displaying that they're knowledgeable, but then secondly they're demonstrating that they're nice, friendly people who the patients develop this affinity for or rapport. We certainly see in areas of our practice where there is someone who has a video, for instance, in one surgery department. We had somebody else in the department say, I know my colleague here is getting a bunch of appointment requests because of having a video. I'd like to create one too. And I think that's substantiated throughout the industry, that from everyone with whom I've talked, they're saying that those physicians who have a video are getting significantly more requests for appointments than those who don't.